So I have a few moments with you this morning, and I thought what I would do is spend some time reflecting on yesterday and responding to some of the comments, questions, feedback, critiques that we got from yesterday. So first of all, it was a full day. It always is at the first time. And we intentionally packed the first day with data. So if you felt like a fire hose coming at you, particularly when Derek was talking, I don't even know how his mouth moves that fast. But we will certainly get you his remarks. So we wanted to give you some data, a foundation of data. But in that panel discussion yesterday morning that Alan so wonderfully facilitated, he said that of the overwhelming theme of the questions that came up from the audience had to do with why are we focusing on or singling out race when there are so many other inequities. And so, of course, each of those people on the panel, shared their perspective, but none of them, were speaking for the foundation. So I wanted to speak for the foundation and tell you why we're not focusing solely on race, but it is a prominent theme. So there are many reasons for that. Reasons include we have to start somewhere, and race is we believe, the most persistent, the most pervasive, and the most poisonous of all the inequities. It's one of the undiscussables. As a matter of fact, it's the granddaddy of all undiscussables. And if anyone should be brokering that conversation, why can't it be us? Why shouldn't it be us? Race is also closely connected to so many other inequities. So if you want to talk about education, which we're going to hear some about later this morning, you just have to scratch once and there's a racial inequity. If you want to talk about housing, scratch once, there's a racial inequity. And the list goes on and on. And the fact is we could work towards trying to solve some of those other inequities and never have to have the race discussion. But if we tackle the race discussion, we can also embrace and work on so many of the other issues. And one of the primary reasons is, as we talked about yesterday and as Jerome was also talking about, we said we want to bring health in reach for all Coloradans. And the fact is that the group for whom it is the furthest reach in this state are brown people, brown and black people. So if that's who we if that's who we want to focus on, we look at who's health the least in reach for, that's who, so that's why. That's part of why. In addition, as you all registered, we asked you, what do you want to talk about? What are you hoping to hear about at the symposium? And at the top of your list was the impact of race, racial inequity, discrimination, and its role in creating the health inequity. So those are many of the reasons, the main reasons why we have not a singular focus, but quite a healthy focus on race. And so when we look at our mission and our vision and who we have committed to be in service to and in service for and in service with, we are talking about low-income, marginalized, minority communities and immigrant communities, and that includes marginalized communities and low-income communities, includes low-income whites. And so for those of you who questions, where's that voice? Why isn't that voice at the table? We agree with you that that is a voice that we wanted represented here today or this week, and it wasn't for lack of trying. We reached out to several of the national experts who have the national perspective, as well as could bring, look at the Colorado perspective on low-income whites and the impact and the disparity that exists there. We just simply could not make, it didn't work for anybody's schedule. But it wasn't because we didn't try, and we certainly agree that that's an important part of when we look at marginalized communities. And, you know, I come from North Carolina, so in Appalachia, and I forgot who yesterday said, you know, that I forgot what the statistic was, 1 in 7 people live in Appalachia. That was amazing. And even they get a name. They get marginalized. They're poor white trash. So they get marginalized with words that way. So yes, that is a population we are absolutely interested in, want to listen to, want to be a part of, helping them bring health within reach as well. So I wanted to comment on that. And then there was some comment around why aren't we talking about health? This is a health convening. Why aren't we talking about health? So my first reaction was, well, I disagree. We are talking about health. But then I tried to take a step back. So well, maybe it could be that we're in violent agreement, but we may have different starting assumptions. So our starting assumptions are that health and what contributes to a healthy individual, a healthy family, a healthy community is a myriad of factors. A myriad of factors beyond the current national debate on health care and health insurance. Those are critical components to what constitutes health, but I know I'm speaking to the choir when I say that only about 20% for what accounts for making us healthy has to do with what happens at the doctor's office or at the bedside in the hospital or at the pharmacy or in the dentist office. That there are all those other factors. So our starting assumptions are if we're talking about education, we're talking about health. If we're talking about safe communities, crime-free communities, we're talking about health. If we're talking about access to jobs, we're talking about health. If we're talking about affordable housing, we're talking about health. So if we're talking about discrimination and how that impacts stress and life conditions, we're talking about health. So those are our starting assumptions. That I don't know very many conversations we could have about any kind of life circumstance that doesn't have some kind of health impact. And it's the health impact on a family, on a community that we're concerned about. And that it doesn't necessarily have to be a health intervention to have health impact. Chief Mullen last night talked about seeing young people who would witness violence in their homes and the stress that causes on them, and how his police department brought in mental health professionals to help with that because he realized the health impact of his community because children saw violence, that it made their community less healthy. So that's how we would respond to why aren't we talking about health, and we think we are. The word may not be mentioned, but is it implicit in everything we do and everything we think about? And then there was a suggestion of, so why don't we make the symposium attendees mirror the demographics of Colorado? So when I worked at the Center for Creative Leadership, there is a program for CEOs and the C-suite called Leadership at the Peak, and it's designed for the most senior leaders. There's usually 12 people in a class, and typically there'd be 12 men, 12 white men often, or 11 men and a woman, and they would always ask the question, why don't you have more women and people of color in this class? That diversity would be so rich. So my response to them was, okay, Mr. CEO, how many of your direct reports are women or people of color? Silence. Okay, Mr. CFO or Mr. COO, how many of your peers are women or people of color? Silence. So my answer to them was, we can't up our representation in this class until you up your representation in your organization. And so that's a challenge, I would say, to you as well. So it's not just about the demographics of the people in the room, it's also about the institutions represented. We want certain kinds of institutions represented in this conversation. So my question to you is, for those of you who are running organizations, what does your workforce look like? So we can't broadly diversify the audience in this room until you broadly diversify your operations. Now, it does bring up a point, though. So yesterday I talked about, well, what if we, because the symposium sells out so quickly, and there are people who are waiting for it to come through their inbox so they can hit enter. And I said, well, maybe next year we'll do a lottery. So that's an option. If we wanted to deliberately to have a demographically representative group, we could curate that. That's a different way of looking at the participants. That may be something we want to consider. I don't know that we will, but that's certainly an option. We could curate and send out invitations for the symposium rather than a registration. So all of those things are things that we need to consider and look at as we continue to examine ourselves and examine how we're contributing to the issues. And we're going to hear this morning also from Susan Batten-Taylor, who runs ABFE, which is the Association for Black Foundation Executives. And so in all transparency, the foundation is a member of ABFE, and I am a board member of ABFE. But one of the things that ABFE looks at is across philanthropy, the underrepresentation of funding to organizations that are minority-led, minority-serving, minority-governed. So we've got to investigate and think are we guilty of that? How much are we guilty of that? What do we need to do better or more of or less of in that arena? And so then one of the other things I wanted to share with you, I want to share a story, then I want to tell you how all of this is shaping the foundation. So I heard just kind of in passing yesterday, several people talking about, is this a relevant, part of this notion of is race a relevant conversation today because of the generations coming after us have a very different perspective on race. And the generations coming after us have very race neutral, don't see color, don't see race. I'm not sure I can buy that completely just yet. So I'll tell you a story about my son who would be mortified if he knew I was telling you this, so please do not tell William I told you the story. But he was in the fourth grade. I think he was in the fourth grade, and my mother had come up for the weekend, and my husband and I were going out of town for a football game. Just as we're checking into the hotel, I get a call from the school. So every parent knows when you see that the school's calling, like your blood pressure goes up immediately. So I answer the phone, and the principal says, first of all, William's fine, but we had a little incident today where another student called William the N-word. I said, okay, let me speak to William. So William gets on the phone. So, William, are you okay? Yes, Mom. I don't even know why they called you. I said, well, are you all right with all this? He says, Mom, it's not the first time he's called me that. And I said, why haven't you said anything to me and Daddy yet? So my son's response was so amazing, I memorized it. So why haven't you told me and Daddy about that? For one, he's just a jerk, Mom. And you keep telling me as a black person, I have to develop some jerk tolerance. For two, he's clearly got some problems. And you keep telling me, just because somebody else has a problem doesn't mean I have to make it my problem. For three, I knew I'd have to have this annoying conversation with you. And for four, if I told you, I know you'd want to talk to his parents, and that would just be one more thing you did that I have to live with the consequences. I was like, check, 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 check. I was like, put the teacher back on the phone. Principal gets her back on the phone. I said, he's fine. What are you going to do about it? So we conclude the conversation. So when I got home, I went to William and I said, you were pretty right on about everything you said, except you were wrong about one particular thing this time. I didn't call that young man's parents. As it turns out, William hadn't told the teacher about it. Another student had overheard the incident and told the teacher. So I called that young lady's parents. And I said, I know as parents, we wonder if anything we're saying is getting through, if anything we're trying to teach them is taking. I just want you to know it is getting through. You should be proud of your daughter. This is what she did. So I called her. But that was one of those aha moments. It's like, oh, do I have to go through this? Do I really have to do this with my son? Really? So I'm not quite convinced yet that we can call victory on this for future generations, that it's only us that needs the work. So that's, and again, please don't tell William, he'll be mortified. So, but how is all of this conversation and everything that we're hearing, everything that we're learning, how is it changing us at the foundation? So one of the biggest ways is that, as the speakers talked about yesterday, and as I'm sure some will talk about today, and as Chief Mullen talked about last night, we have to pay attention to the lived experience of the people whom we want to be in service for. We have to understand from them, not just from you, who are leading organizations. We have to hear from them directly, and from every corner of the continuum of accounting. As an example, in North Carolina, we had an education initiative we were about to start, so we wanted to hear from different communities. So we went to all communities across the spectrum. We stopped people in the driveway, in the drive-through at Bojangles. We went to the tiendas. We went to the grocery stores. We went to the bridge clubs. We went to laundromats, and we asked people, so, what's in the way of your child what's in the way of your child getting their best education? So in the affluent communities, we heard we need more AP classes, and we need more sections of AP classes. All the way down to, in some of the poor neighborhoods, we need our kids not to be subjected to gang recruitment on the bus. So again, we were trying to bring education within reach, to use this phrase, that wasn't what we called it. And so, okay, so we said for the affluent folks, the education's in reach for you. You can advocate for yourselves. We don't disagree that you need, and your students need more AP classes, but that's not where we're going to focus. We've got to do the same thing when it comes to health and communities. What are the communities for whom health is not in reach? What does that look like? And they're not monolith. They're not monolith in an urban community. They're not monolith in a rural community. So we've got to understand what the lived experience is and have it influence and shape how we approach our grant making, how we approach our policies, how our policy agenda, how we approach our capacity building agenda. We also have to create a broader network of folks that we want to work with, of folks to engage with and partner with and listen to, particularly the business community across Colorado. So one of the steps we've made is we have joined every chamber of commerce in the state of Colorado. That's about 350. We joined 350 chamber of commerces. Because as our staff and all of us are out in communities, we want to be able to talk to the business community. We want to say, we want to support your efforts to make this a vibrant community. Because if you have a vibrant community with jobs, with a good education system, with a good health system, you're going to have a healthier community. We would love to have every chamber of commerce in this state have health as one of their foci. And what can we do to help them move that agenda? We're also being much more deliberate about seeking out grassroots organizations, people who are native, who are on the ground, who may go unnoticed, who may have gone unnoticed to us in the past. We're looking for them. And we want to be and work with them because they know their communities. They know how to guide us in the communities. They can vouch for us because we're still outsiders. We're still strangers. And so we're looking for that relationship. And we know with a lot of small organizations, we may not be able to go straight to grant making. We may have to start with capacity building. You know, what do you need to be your most effective at the work you're doing? And we are committed to doing that. The other thing we want to do that I think the symposium is evidence of, that we want to challenge not only ourselves, but challenge those of you who we already consider kindred spirits. We need to challenge our thinking. Have we gotten into a rut? Have we gotten into a velvet rut? That we are so just kind of on autopilot that we forget to stop and ask ourselves, are we still relevant? Are we still addressing the current needs? Are we really doing this for the right reasons? Are we really doing this with and for the people that we care about and that we serve? So we want to challenge ourselves, and we hope you will hold us accountable to challenging ourselves. And we will work with you to hold you accountable and hold each other accountable for that. And I think the last thing that's not a change for the foundation, but it's just more of a magnification, got to be explicit, that we don't see the people in these communities, low-income, marginalized communities, we don't see them as liabilities in the community to be fixed. We see them as assets. We see them as assets to be mined, and that some of the most resourceful, smart, wise people you will ever meet are people who have to figure out every day how to rub two nickels together and get 50 cents. And we have to respect that they have an expertise that we could never have, and we hope we never have to develop. I hope I never have to learn how to be that resilient and that resourceful. But they have learned, and they've learned how to do it well, and still somehow get out of bed every morning and go to work and do the best they can for their kids. So we are really being shaped and influenced and changed at a very human and humane level about how we look at our work. Every dollar that we invest has a person on it. I mean, not George Washington, that person, but there's a person that's going to benefit. And we have to keep remembering that it's not the institution that got the money who is the client. It's the person who's the ultimate beneficiary. It's who the client is and who we care about and who we want to have them say that their lives are changed. Not just because of what we can do, because we can't do it all. We think we can contribute. We hope that we can make meaningful contribution, but it can't be something we do alone. But it certainly can't be something we do in isolation and in thinking that we already have the answer. So with that, we have a day ahead of us that is, again, another provocative day, a day about thinking about what can we as individuals and what can we institutionally do? How do we continue to challenge our thinking about inequity and equity? How are we in our organizations positioned to either enhance, destroy, or are we part of the problem?